Now on the doctor's note this morning, heart screenings are not just for adults. This weekend, Virginia Mason Franciscan Health is teaming up with the Seattle Seahawks and the Nick of Time Foundation to offer free youth heart screenings at the VMAC in Renton. Holly's down in the Arc Lounge this morning with Dr. Mariko Harper, a cardiologist with Virginia Mason, to talk about why early detection can truly save lives. Holly?
Yeah, Steve, this is such an important cause. And Dr. Harper, thank you so much for being with us today on Arc Seattle. First, tell us about this upcoming heart screening event. Walk us through what it's like when you arrive at the VMAC.
Absolutely. So this is the third year in a row that Virginia Mason Franciscan Health is collaborating with the Seattle Seahawks and the Nick of Time Foundation. And from 7:30 to 3:30 this Saturday, the 28th, you walk into the Virginia Mason Athletic Center and there is going to be a host of volunteers. You sign your child up between 12 and 24 years of age. There's a health screening, a free EKG, that's an electrical signal of the heart, non-invasive, takes a few minutes, blood pressure check, a hands-on CPR station, and there are a host of volunteer cardiologists, nurses, sonographers, our entire cardiac team that will be looking at each child, and if there's anything going on, symptoms such as chest pain, dizziness, passing out during athletic activity, or if there's a family history of some heart things that may be suspicious, or if, even blood pressure is elevated, there's an opportunity for not only counseling, but even getting limited echocardiograms or heart ultrasounds. And if we find anything, then we set them up for follow-up.
Why are heart screenings so important for young people, especially young people that seem completely healthy?
Because that's a really great question, because while it's rare, heart disease in young folk, unfortunately, tend to be silent until it's a big issue. So we like to find things before there's anything concerning, before symptoms, and then we can follow our patients, we can do a lot more about it. There are, unfortunately, a host of genetic or hereditary heart conditions. Today actually happens to be Hypertrophic Cardiomyopathy Awareness Day.
Wow.
And hypertrophic cardiomyopathy is the #1 inherited cardiomyopathy worldwide. It's about 1 in 200 to 1 in 500 people, and it's the #1 cause of sudden cardiac death in young athletes.
And what kind of heart conditions, besides the one you just mentioned, are you looking for during this event and in young people?
So we're looking for everything. We're looking for everything from elevated blood pressure in young people, hypertension, to congenital heart disease. That means being born with something structurally typically with the heart, like an abnormal heart valve, a heart murmur, or electrical disturbances. So something that we catch on an EKG, that the heart rhythm is off, but we may not see it at all. It's completely silent until it's not.
Mm-hmm. All right, as a parent, and maybe for those coaches too, what are some warning signs? What should we be looking for in our children?
Absolutely. So dizziness, fatigue, short of breath with activity suddenly, chest discomfort or chest pain, those are all hallmark signs that there could be something going on. Also palpitations or the heart racing. So while much of the time it isn't anything serious, it's absolutely important to take it seriously and get worked up, even just for the reassurance.
Yeah, if you spot any of that in your children, right, call your medical provider.
Absolutely, or bring them, if they're between 12 and 24,
Right.
bring them this Saturday for a free screening. It's actually much more comprehensive than a typical sports physical. So last year I brought my 12-year-old, and it took him about 10-15 minutes. He got to take some pictures with, Seahawks and cheerleaders, learn some CPR. It was a great event.
Yeah, fun and also healthy too.
Exactly.
You mentioned the age, 12 to 24. Why is that specific age so important? Why is that focused during this event, that the focus?
So that's when our children start being very athletic, and that's the biggest risk period where there can be sudden collapse or sudden cardiac death. So we're encouraging our parents to bring in their kids and the young adults to come in every 2 years for screening for this annual event.
Yeah, if screening does detect something, what happens next?
So we'll make sure that the kids get hooked up with the appropriate pediatric cardiologist or specialist for ongoing care.
Okay, and then how can families sign up for the event on Saturday?
Yeah, so there's a lot of ways to sign up online. There's also options to walk in, but we really encourage going online, Nick of Time Foundation, our website, and register your child.
Yeah, you want to make sure you have the right professionals
Absolutely.
for the amount of people coming.
Well, we're hoping to screen 1,000, so we'll see. Yeah.
Wonderful.
Yeah.
Okay, thank you so much, and thank you for this effort too. And
Thank
making
you
have
for
some
having
fun.
me.
You're welcome, Steve.
And how great that our Super Bowl champs are part of this too.
I know, it's fun and for your health too. It's just a win-win, isn't it?
That's right. Yes, it is. Coming